Hi there, I want to show to you in how to create your cancer evaluation. This is for the physical therapy, occupational therapy, doing the evaluation and re-evaluation. So I just cover here at the top the name of the patient. So for HIPAA purposes, so let's start. I will divide the training into several parts. So we will do the introduction until the diagnosis and history. So here, these are things that you cannot miss when you're doing the evaluation to check the patient identity. Doesn't matter child or not. Time in, time out. It's military time. Our, our, our average is 55 minutes, and the date, visit date. And the visit date, you need to remember the visit date is must be always the same as the signature sheet if you're using the paper, or of course if you're doing KVV, automatically it's gonna be the same as your visit date. But when you're using the KVV, the electronic signature, make sure the signature is in between the time in, time out, or else the Teramax back office will return it. As when you're doing the documentation, try to complete everything so you don't need to you don't receive return for review from the back office when they're checking it. So this training will help you how to avoid the back office of quality assurance, how to avoid in returning your notes. Okay, so this is what they're looking for, and then here this must be filled out. This must be filled out because if you don't fill this out, the progress note of your therapist or therapy assistant will be also blank. So then what will happen if you put it blank, and then when the physical therapy assistant or OT quota submit their progress note and it's blank, what will happen is the Teramax back office will return to them their notes, and then of course they're not gonna be happy, but they're looking at the evaluation. Oh my goodness, you didn't put it too. So make sure you put it. Okay, and then of course you need to put if what is this is observation or onset, and then here the date. If this is an adult and you're doing the initial evaluation, use the initial evaluation, the start of the cert. That's what I'm recommending, unless you feel like you need to really put a different date. But if ever you're not sure, just use the start of the cert. And on the child is a SOC, a start of care. Well, are you gonna see the SOC? I'll show you later on. It is on the patient's when you drop down the the patient's documentation, the back office documentation. So the medical diagnosis and the PT diagnosis or OT diagnosis must be coming from your own, but it must be related to the medical diagnosis and the functional ability of a child. Okay, and the relevant medical history, you cannot leave this also blank. We have pattern here what to put. You need to put the child's gender, the child's language, the primary language. Actually here this is missing, so let me add this. 7-year-old female, Hispanic. I think this passed because there's a Hispanic word, but it must be with primary language of Spanish patient. So the insurance wants the age, gender, primary language, date of birth, SOC, and medical diagnosis, and if there's therapy before, and of course there's past medical history. So it must be again the age, the gender, primary language, date of birth, SOC, and the medical diagnosis. If you notice, you just copy and paste actually from here. And then the past medical history, but important is they want to know if this patient has therapy before, physical therapy or other therapy. But most importantly, if you're doing evaluation for PT, then the insurance want to know if this patient has a prior therapy, PT service, so you need to ask the parent. The next one is prior level of functioning. It's important too that you need to fill out, because from here you will know that this patient 6 months ago the patient is not feeling has been walking. Just suddenly because of the hospitalization the patient wasn't able to walk. So it's good for you to know and also the insurance will have to see that so they can paint a picture of what's going on with the patient. And you can use that also as a reference when you're creating your plan of care, your goals. Patient goal, either if you're dealing with a pediatric, you can ask the parents or a caregiver. If the that we're dealing with the geriatric, and the geriatric can able to narrate what is their goal for physical therapy, occupational therapy, then you need to ask them. It's very important for you. It's because on your plan of care, on your treatment goals, whatever is they wanted to happen. For example, oh, I want to walk again, and of course, if as long as it's a working goal, I mean a reachable goal, then we need to uh, uh, set that goal. We may not be able to walk the patient right away, but at least you can create a milestone goals to achieve that goal of the patient. It helps. It's really helpful when we're creating a goal. And on the patient satisfaction, one of the things that we work on when we see patient is customer service and satisfaction. So our company actually every 60 days or 30 days we do a survey. We ask the patients how happy they are with the service, and if the patient's goal is for her or him able to walk, and you were able to walk this patient after 6 months, or after 2 months, or after a month, then of course they're going to be very happy, and of course you change the life. The next one is the precaution. There's two things that I wanted to make sure that you don't miss in the precaution: safety in fall and universal. Whatever type of patient, these two must be there. Why? Safety and fall precaution, of course, that goes without saying. The next one is universal precaution. Of course, you want to make sure that you are clean, you take care of yourself, and you don't give bacteria to the patient. And you can add whatever precaution that is applicable to the case of the patient. And then here, homeboundedness. With a child, actually, usually you don't need to put that. But for to make it all generic, TheraMax has asked the therapist to put it too. Just put homebound, other child or adult. If it's not homebound, then there's no reason for the adult to have home health, because one of the qualification of home health is the patient's homebound. So if you're dealing with adult and this patient is not homebound, it doesn't apply here, then you need to notify home health agency, whoever's are the owner of this patient, because this does not qualify for home health. So it will be yes in order for you to continue. And then the last, I think that's it. This is the first part of a tutorial, from the patient identity confirmed to the homebound. So all of this must be filled out. Thank you so much.